Medical procedures against patient's own will. The case is Bovia versus Superior Court. The background of this case took place in 1983, and just a little background on this case. Bovia was a woman who actually had severe cerebral palsy, and she was quadriplegic, and that made her completely bedridden. So this was very difficult for Bovia, and in order for her to actually perform activities of daily living, she had to rely on other people in order to do that. And because of her severe condition, she didn't want to live anymore, so she decided not to eat anymore, so she wanted to starve herself. And her physical state became so life-threatening because she wasn't getting the nutrients that she needed, and she was in a really critical state. So the medical team decided to insert a nasogastric tube against her own will in order for her to live. They didn't want her to commit suicide. The key stakeholders in this case are all the patients who desire to end life-sustaining treatment but do not have the ability to physically refuse the treatment. Some of the most important issues in this case include the ignorance of autonomy for a patient who actually has decision-making capacity. And another important issue is utilizing healthcare supplies. So, for example, in my case, it's utilizing nasogastric tubes for patients who actually want the treatment. The most valued principle in the American medical practice is autonomy. So, it's really important to focus on the significance of autonomy. If a patient decides to refuse any treatment, that decision should be respected. Another significance is respecting a patient's decisional capacity. So, according to her book, Johnson says that if a patient understands information and that patient's able to engage in communicating that person's own values in relation to the physician's recommendation, that patient is actually able to either accept or refuse the recommended treatment by the physician. And another significance to this case was that prior to this case, fluids and nutritions were actually considered treatments that a patient couldn't choose to end, so that treatment was actually a requirement. But after Bovia's case, that actually changed. So the right to refuse treatment became possible. The thesis. In cases where patients have significant physical limitations that prevent them from taking action on their own, their right to autonomy outweighs the medical duty to preserving life, effectively suspending beneficence. The ethical principle in conflict is autonomy and utility versus beneficence. Autonomy, as we all know, is the right of one's own body. However, in this case, autonomy was actually ignored. So even though Bovia had decision-making capacity, the healthcare team didn't allow her to end treatment because that would mean that Bovia would commit suicide, and the healthcare team didn't want that to happen. Utilizing equipment is another ethical principle that was not taken into consideration. So the medical equipment could have been saved for patients who actually desire to have nutrition and hydration via a nasogastric tube. And when the nasogastric tube was placed, the healthcare team had beneficence in mind. So they wanted to avoid Bovia to cause harm to herself and commit suicide. So the healthcare team did not want Bovia to harm herself, and they wanted the best for her. The physicians in this case actually failed to fulfill the requirements of the AMA Code of Medical Ethics. They actually did not deliver care with sympathy and reverence for human dignity and rights. The physicians actually disregarded Bovia's dignity and rights because they performed a treatment against Bovia's own will. And the thing was that Bovia was actually able to vocalize what she wanted, but the medical team thought that the insertion of the nasogastric tube for nutrition and hydration was superior to what Bovia wanted. They thought it was superior to Bovia's rights. And this case also ignored the right to refuse treatment law. The healthcare team did not take into consideration that Bovia was able to decide for herself. Bovia actually knew that the nasogastric tube would help her live, but she wanted to refuse that treatment, even if it did mean that. The outcome of the case was that the court determined that Bovia had the right to have the nasogastric tube removed, so the court allowed Bovia to have what she truly desired. The legal outcome acknowledged that the right to refuse treatment by respecting autonomy. And this outcome is the best ethical outcome because Bovia knew what the treatment meant, but she still wanted to refuse it. So Bovia saw both sides to this nasogastric tube. The solution for the future is that hospitals really need to prioritize rights of the patients instead of proceeding with treatments against the patient's own will. And if hospitals actually listen to what the patients want and actually respect their decision, this can actually be really beneficial because patients can develop a trusting relationship with their healthcare providers. And if the healthcare providers actually do things against the patient's own will, that can actually cause the patients to avoid seeking medical care, and it could cause the patients to not trust healthcare providers anymore because they do things against their own will. So it's really important to prioritize the rights of patients. Even though the healthcare's responsibility is to preserve lives, one's autonomy actually predominates the physician's required medical procedures. So patients should have the authority to personally decide healthcare decisions if they're competent.